Hello and welcome. It's the Hilarious Humanitarians Podcast. We're back for episode number 13. Frances Echeverria, licensed marriage and family therapist here.
This is Deanna Silverman, licensed clinical social worker, Hilarious Humanitarian on Instagram, and Frances is Shut Up Skippy on Instagram if you want to follow us.
Yes, and we're here for episode number 13, lucky number 13. So we thought we would jump in today with a topic that, whether you want to admit it or not, it has touched you in some way, shape, or form, and that is substance use and addiction. And we want to try something. Now that we're 13 episodes in, we feel like we should probably have a little bit of structure. And
what's that?
Yeah.
Structure.
So Deanna and we're really just trying this podcast thing out, but we've had really great feedback. A lot of people who tune in every week. So we want to be able to bring you our best above average attempts at doing it.
I like that, above average. I really like that. Thank you.
Hey, B's get degrees in the program I went to.
Right.
So to give you an idea of the direction of the podcast today, we're going to give you a little bit of background on addiction and substance use, our own experiences working with it and in life in general. Some family dynamics that I think people overlook, but definitely fuel the substance use cycle. Oh, a topic that Deanna loves talking about, and that is marijuana and the recent legalization in California. If you could see her cringe, it would be great. I have a really interesting little bit of information from the CDC that will make you question whether or not you are a heavy drinker. We'll give you some ideas on resources if you or someone you know needs them, and something new you wanted to start this week, and I'm excited about the good news feed.
Yeah. On Instagram, I routinely put up good news in a world full of just bad news, that creates a lot of fear and just drives ratings because people like to traumatize themselves, me included. I think it would be really, really good for us to start highlighting our chosen kind of favorites of the week in terms of good news. So we'll be doing that later in the show.
I'm so excited about my choice too. I have a new celebrity crush. Chris Pratt has to move over.
Oh, really?
He's been replaced by an older man.
Sometimes it happens.
Sometimes. All right. So let's jump into addiction. So before we get started on the background of addiction, Deanna, have you heard the argument, or maybe you've been guilty yourself of telling someone, why can't you just stop? It's a choice.
Yes, I have never said that to anybody. There's a lot of things I'll admit to when I was wrong, but this is one of those things like I've always kind of had in the back of my mind. Like, I don't think anybody decides to like pick up drugs or alcohol and say to themselves, one day I'm going to be totally addicted to this. It's going to potentially ruin my life, but fuck it, I'm game. I really don't think that people enter drug use, even like a recreational drug use, and think long-term effects. I would hope they do. I'm sure some people do. Honestly, I'm neurotic, so that's actually something that's gone through my head. Like, I don't want to use anything for fear that I might become addicted. But so I've always just kind of like had a pretty non-judgmental approach when I think about people who have been addicted. So I don't think that it's that simple to quit once you're in the throes of true addiction. But I've heard it time and time and time again, working in the medical hospitals, working in the psych hospitals, from families and friends. I mean, I watch, that show Intervention. Like, I love that show. So I've definitely heard it. It's a moral issue, like.
Right. Like if you loved your kids more, if you loved us more, if you cared, you would stop. That's right. Really a very common script. And I think it comes from a place of just desperation. But the reality is that's not really how addiction works.
Right. We'll talk about this more and more, but like in this episode, we'll be discussing the different models in terms of like looking at addiction. And when I say models, it's like a perception of how addiction kind of lives within us and how we can treat them. And actually one of them, it's called like a single focus model, is the moral model, which is essentially somebody saying like chemical dependency occurs as a result of like moral weakness. Like you're just being weak. You should just choose not to use and be done with it. Personally, I see that as like coming from a place of like a lot of judgment and can end up hurting somebody who's addicted and wants to get clean, because there's a lot that goes into gaining sobriety once you are in a place of feeling fully dependent on a substance. You do need like medical attention or help. And we'll go into further into like when that comes into play.
Right. So first of all, for somebody to be technically diagnosed an addict, there are certain criteria that people like Deanna and I and others working in the mental health field have to follow. And that's most commonly in the DSM. The most recent version is number 5. And what it does is it breaks down into substance use disorders, different levels of severity. And some of those things do include things like withdrawal, and also tolerance, because people tend to, as they become addicted, need more and more to maintain a certain level. And in some cases, when you're working specifically with opiates, often that level isn't even, it's not even to get high anymore. It's to keep from getting what is often called dope sick, because your body becomes so dependent. You often hear about it when like people will say, you know, with addicts with alcohol, they'll wake up the next day and they need to take a drink just to take the edge off. And that's because our bodies can become physically dependent to many of these chemicals that we put in our system. So just to understand, addiction, it does build in that way with your substance of choice. Now, not everybody who uses drugs or alcohol recreationally or even regularly is an addict. They're not. I mean, they may choose to participate in these things, but it's kind of like a switch that gets flipped in your head. So a non-addict may go, you know, I've been drinking a lot lately. Oh, my wife's getting kind of mad, or, you know, I'm putting on a little weight, or I'm slacking off at work. I'm going to stop. Or I'm just going to have one beer at dinner. And they're good. They can stop. The addict, though, can't. And one beer turns into, you know, making runs to the store to get more, or just, you know, it just, there's no stop button. Once that button or once that flip is switched in your head, there's no stop. And I think that's what's really important. Then there's the preoccupation, like, when's the next one? When am I going to have the next one? And that's another big sign of addiction. So
I wanted to add too, like, so I've met a ton of people in my life. I've had a very close friend who's in recovery. He's been in recovery for like 7 years. I used to work with somebody who was in recovery, and we used to talk a lot about our relationship with alcohol. So for example, I do not, this seems so strange to so many people, but I've actually never finished a beer to myself. I've never acquired the taste for alcohol, literally, like any kind of alcohol. It just doesn't taste good to me. In fact, I had this kind of like running joke where when I was like 18 to 22, I was dating a guy who wanted to be in the FBI. And so like when I met him, he was like, consider myself straight edge. I don't do any drugs. I don't drink. I don't do anything. I don't party. I don't go to clubs, nothing. I want to be in the FBI. And like, as this 18-year-old who's like, oh, I love you and I'll do everything to support you. Like, I just like jumped on board with that. And so I make this joke that I like missed the window of opportunity of 18 to 21, 22, where like people are experimenting with things at times. I didn't at all. And then I also like come from this like place of, people will say to me, oh yeah, beer tastes like crap, but then you just acquire the taste. And I'm like, I don't get that. I tried it once. It tasted like crap. And why would I try to acquire the taste of crap? Like, I'm not judging anybody who loves
it's not
beer.
your thing.
Everybody pretty much in my life loves beer. My husband loves beer, and the poor guy, he can't even drink it because he's gluten-free. And so we have to like find him like gluten-free options. But where was I even going with it? Why did you bring this up?
Well, I think because it does lend well to the conversation, what we were talking about. Not everybody who drinks or experiments is going to go down the road to misuse.
Yeah. Okay. So I figured it out. So when I was talking to my friends who are they're in recovery, they've been in recovery, they'll tell me like, I've always been so envious of people who, like yourself, either could care less about alcohol or can go get a drink, 1-2 drinks, and then that be it. Whereas they were saying like in their life, once you press go, once that first drink hits their lips, like they just can't stop. And it becomes excessive drinking. And so it's just interesting to me how some people can be like pretty moderate about things and like it can purely be recreational, but we also need to be mindful that sometimes things get out of control, and there are certainly things that are out of our control, like thinking you have this under control. How many times have we heard that? I thought I had things under control, and then one day I realized, shit, I've been using every day, and now they've become dependent and need it.
Right. And that's kind of the hallmark when anybody comes into treatment, or if anybody even asks me, can you stop? And I mean, really stop. Like, do you need to have it? For instance, I would use it back when I was a little younger, especially when I'd have to go out and, I do radio, but when I would have to go out and interact with people, that's a whole different story, and kind of host. And it was an easy way to kind of take the edge off. I know that I used it to kind of manage a little social anxiety.
Sure.
Then as I got older, I was like, I wonder if I could do this without that. And then so now it's one of those things where like I like a really good beer. I'm kind of experimenting with some red wines in terms of finding the stuff that I like, but I'm not a heavy drinker. If I have a couple of drinks a week, that is a heavy drinking week. Not to say I'm out to judge anybody or whatnot. I can tell you my favorite things on the menu or in the store, but it's just not something for me. Now here's one of the reasons why. I also recognize my family has a very, very, very strong background with alcoholism on both sides. And just like you get your face shape, your eye color, and your metabolism from your parents, it's very likely that you will, if your parents have a history of addiction, that you will inherit that gene. Mm-hmm. And so this is why I think as a parent, it's important to have these conversations with your loved ones, with your kids. So really quick on the addiction thing, I just wanted to throw out some information out there. There's a lot of stuff that's on the neurobiology of substance use, because what they've really started to figure out is that it is a chronic disease, much like someone who has diabetes. Diabetes might become you might be able to manage that where you're not having to like think about it all the time. You get into habits that help you support a healthy lifestyle with being diabetic, but it's always there in the background. So addiction is a chronic disease. That's the new kind of approach to it. And I think in that way, we are developing some compassion for people.
Right.
Because you don't just go up to somebody and be like, oh, you have diabetes? You don't need that insulin. Just eat the cake. We realize like science doesn't work that way.
Or like they're going through, like somebody's going into like a diabetic coma and they don't have any treatment. What are you going to tell them? Just suck it up. Think positive. You would call 911. I want to also talk about real quick, alcohol, for example, how you were talking about some people who are addicted, like they'll wake up in the morning and need to like crack a beer to like take the edge off. Alcohol and Xanax are some of like the most dangerous substances, and both are legal, right? Mm-hmm. They're prescribed for anxiety most of the time, and alcohol.
Pain medication too is prescribed, and
right, exactly. And like the opiate crisis is out of control in this country. But with Xanax and alcohol specifically, if you get to a point where like you are abusing these substances, you are at great risk of, if you were to quit cold turkey and fight through the shakes and the tremors and the profuse sweating, you are running a really high risk of having a pretty significant seizure. And a lot of people don't realize that. Mm-hmm. And so that's why when people get detox, it's like a medical detox. You're being medically monitored. And so when people are so far into addictions, I'm just talking specifically Xanax and alcohol, because that's what I would see the most in the hospitals that I worked, where people were coming in saying that they're taking like 20 Xanax pills a day. That's why I personally, like, I'm not judging anybody that takes Xanax, but whenever I have friends or family who get prescribed Xanax, I'm so clear about them being very, very careful about following the dosing and trying to get to a place where you're not on this stuff long term, because it's so highly addictive and your body does start getting used to the dosing. And so then you just need to keep increasing it. I was on Xanax myself, and it's funny, I like look back on it. I was prescribed Xanax when my mom died, And I look back on it and it's like, why was I prescribed Xanax like a month or two after my mom died? Shouldn't the doctor have said to me, let's check back in a few months? Like, I was still functioning. I was just obviously anxious and sad, and I couldn't sleep because my mom just died. You know what I mean?
Right, right.
And they just like signed a prescription, and I followed suit because my doctor, like, we hear this all the time, like, oh, my doctor prescribed it, so it's fine. That's not really the case. Well, it is the case. They did prescribe it, but you are always going to be your best advocate. We have to realize that nobody's going to know how to live our life and how we're feeling as much as like we know these things. Like, you're living in your own body. So for example, when my mom died, I obviously had some anxiety and some depression, but that is not really depression as far as I'm concerned. It was more a grief response. I should be
natural
feeling.
response.
It's a natural response to grief. Why are we medicating a natural response to grief? And I also want to be very clear that I'm just talking about my own experience. This is not supposed to be generalized through, everybody's use of Xanax. However, I've seen so many people come in and out of the hospital that tell me, oh yeah, I'm prescribed Xanax. And I'll ask them, like, how long have you been on Xanax? 25 years, like 10 years. For what? Oh, I was anxious in college, thinking they graduated a few months ago. Oh no, I graduated 15 years ago. Why are you still on Xanax? And I've had patients be like, come to think of it, I don't really know. It's just kind of what I do. Yeah, it's a routine. And so when I went to my own psychiatrist about a year after I got prescribed Xanax, and like, I never even took it really because I don't like the way it made me feel. And actually, I believe Xanax doesn't allow you to go into REM sleep. Is that true?
I'd have to check. I'm not sure.
Let's look into that, because like I think somebody told me that, because I would always knock out from it, but then wake up not feeling very rested. And I think something goes on in the body. So anyhow, I go to my psychiatrist and I'm like, I don't want to take Xanax anymore. Like, I've been filling the prescription and I have it at home, but I never take them. And she said to me that she was literally proud of me, and that very few clients ever come to her and ask to be taken off of things. We wait for somebody else to tell us what we should be doing with our body. And once again, I want to be clear, there's some medications where we can't be going to our doctor, or we shouldn't be going to our doctor being like, I thought about it and I don't think I want to take these antipsychotics. I'd rather be floridly psychotic. Like, obviously.
Yeah, well, it's a case by case.
Things, but it's case by case. And I just want everyone to understand that you really need to like think about what it is that we're doing, what it is that we're putting in our body, and why.
Well, and I think yours is a good example that eventually the grief lifted, and that's a natural response. I had something similar where my anxiety went through the roof a few years ago, and I was on a couple of different medications plus sleep medication. And we talked about this back with last week with coping skills and burnout. And I mentioned how on like Sundays, if I got really anxious on Sundays because Monday morning I had to go to work. Well, it was a combination of factors. And the only thing that cleared that up wasn't the medication, which was basically like Pepto-Bismol for all of my emotions and just numbed everything. It was, I needed to change my environment. I needed to develop coping skills and identify the things that weren't working for me so that then I could feel better without it. Because I don't think that the answer is numbing everything. And that goes into addiction. When you're using a substance to numb your feelings, as much as those feelings hurt, you have got to sit with them, address them, and fix the patterns, because your number one coping skill, if it's drugs or alcohol, is going to become like that crazy ex that you love and you don't want to get rid of, but you realize they drive you crazy. And then they leave for a little bit and you remember how much you love them. So you bring them back and then you're like, oh my God, this is why I don't have you in my life. Just replace that with your drug of choice, because that is exactly the dynamic that happens when you're using drugs or alcohol as your coping skill. Mm-hmm. So I think it's important that we always push that. And when we're talking about addiction or just substance use disorder, substance abuse, that we always think of like, why am I doing this? Is this because I'm trying to cope with icky feelings? I know those feelings hurt. Been there, done that, do it regularly, but drinking them away or taking something to go to sleep so you don't have to feel them on a regular basis is not necessarily the right answer.
Right. We're putting a Band-Aid on things. And I think a lot of times people will either start off using substances as just purely recreational.
Absolutely.
Or as a self-medicating just kind of process, because we are trying to mask our feelings. And it might be actually quite innocent, because a lot of us do suffer from anxiety. I don't know anybody that hasn't gone through some element of trauma in their life, and it could be very uncomfortable. Like, life can be pretty uncomfortable. And so it might start off as rather innocent. I would rather have fun and feel light and happy rather than feel a little bit of discomfort, but we just need to be aware there is a light at the end of the tunnel. And if using substances is impeding our ability to function and have functioning, healthy relationships with people, then obviously that's giving us a clue that we need to taper back or stop completely, but also address, if you started using to mask feelings, we need to address those things as well, or it's always going to be kind of the elephant in the room. And it could potentially be like an influence to relapse. And you owe it to yourself to live a life where you're feeling less discomfort from things that I can guarantee weren't your fault to begin with.
Really quick on that relapse thing, I think that's important to mention, is that we need to view addiction as a journey. There is no end point until you die. You don't just get over it, and relapse happens. In fact, I saw a statistic where it says more than 60% of people treated, that means sought out treatment, will experience a relapse within the first year of being discharged. And you can remain at risk like potentially forever, because who knows, I've worked with someone who he was 20 something years sober on alcohol. He got in a car accident, had this like really traumatic medical issue. And then lo and behold, he's developed a whole new addiction to somas and sleep meds.
Right.
And so you have to be aware of that it could come up, because life is going to have its shit moments where someone dies unexpectedly, or you lose your job, or, you're sober off of opiates for so many years, you get in a massive car accident and they shoot you full of drugs, because you just broke everything. That's a potential for it going downhill again. And so that's where those coping skills come in handy. I thought what would be a really good kind of transition here is you were talking about recognizing the relationships and whether or not your use of substances or someone else in your life, if that's working with relationships. And why don't you talk to me a little bit about some of the family dynamics you've seen?
Before we jump into that, I want to say one more thing, because you just sparked something in my brain. I had so much respect. I still do have so much respect. And this goes back to being your own advocate. When I was working in the ER, there was a guy who actually came in, had a traumatic car accident, and he was his best own advocate. Like, he was wheeled in on the gurney. And I remember this clearly. He was yelling, like I heard him from across the room screaming, I'm in recovery. I'm sober. Please do not give me any like morphine, Dilaudid. He was listing off like all the narcotics.
Yeah, no opiates or any
no opiate based medications. Please don't. It threw everybody off in a way, because at first when you always hear yelling in ERs, you're immediately like, oh God, call security, Right. But this guy was so committed.
I love him. I love him.
Seriously. I think about that. And this happened like 4 or 5 years ago. And I still think about that guy. And I ended up following him throughout his admission. He ended up getting admitted to the hospital. And his entire admission, he stayed strong to that. In fact, like usually in hospitals, there's that little whiteboard on, for every single patient. And like in big letters, it was like, no narcotics, no narcotic medication at all. And this guy was proud of his sobriety. He was talking to everybody, and he fought through like some major injuries without any type of narcotic medication. I was like super proud of that guy.
It's also as simple as telling your dentist,
Right.
So those are and that's, I think, the thing that we can bring some honesty to is when there are people suffering with addiction, the things that people don't have to worry about. For instance, I'm going to go to dinner with my family. There's going to be alcohol on the table. To have to think about that 24/7, or to have to think, now I have this issue with pain meds. I need to tell my dentist. Those type of things, like, it always has to be front and center. And so for family members, they need to be aware and sensitive to that, but not overly involved, because it's each person's own recovery story. One thing I did want to point out real quick about the relapse is I said it's a journey, and it's so cheesy. It's a journey, not a destination. If you take the wrong road when you're on your way to somewhere, if I'm going to go drive to see Deanna and I take the wrong exit, I'm not going to turn around and drive all the way home. I'm going to get back on the road, right?
Right.
And so those little relapses it's like, how long do you stay out on the wrong path before you come back?
Right.
So
there's relapses with everything in life when you think about it. How many times have I been on a diet? Talk about addiction. Like, my addiction is probably like candy, terrible food.
There's interesting research about sugar actually being really addictive.
Oh yeah. Isn't it as powerful as some illicit drugs?
I've heard.
Who knows? Yeah. We are not scientists.
So what is the family dynamic that you've seen come forward?
Lots of denial. Once again, not judging, but a lot of denial and a ton of enabling.
So explain to me what enabling is, because people have a real hard time wrapping their head around how a family can worsen addiction.
I will get into that, but just for sake of clarity, I am literally reading the definition of enable. Since I love to ramble.
Crystal clear.
I want to be crystal clear. Enable, verb. Number 1, give someone or something the authority or means to do something. So you're allowing, you're permitting, you're empowering. You're making it
okay. You're playing a role in this dysfunctional play.
Right. So here we go. Enabling. I've seen this play out at least, a couple hundred times in the last 15 years I've been working. The addict is living at home, in their parents' home. They're not paying any kind of rent. They're not contributing to the household. They're doing drugs in the house. And let's take alcohol, for example, or just any kind of illicit drugs. The person just knows that that's their safety zone. Like, they can just stay home and use, and it's the elephant in the room, and nobody's really talking about it. And if they are, it's just kind of in a roundabout way. And sometimes the families will even go on runs for them, even though the addict will just say the addict, for this conversation. I hate titles because it feels kind of judgmental, but I do want to kind of hit the nail on the head here. Okay, I just had somebody, not just, actually, it was like a year ago. The dad said, I knew she was using, but she also told me that her car needed to be fixed. So I gave her $1,000 for Christmas.
Come on.
I know. And I was like, did she get her car fixed? And he's like, come to think of it, I don't even know where her car is. Okay, so her non-existent car needed to be fixed, and you gave her $1,000 for Christmas, and she was like a serious, severe drug addict, and she was living in her parents' house. That's enabling. You don't have to necessarily pack the pipe or roll something. You don't.
Right.
You don't have to be participating with them in their room and you both getting high to be enabling.
For instance, if a partner is always covering for their partner for why they're not at family functions, or calling in to work for them because they're sick, or just kind of playing into the role that perpetuates that wheel turning in that direction. And what ends up happening is that, I don't think we have enough time really today to get into codependency, but what ends up happening is often the way pairs hook up is that there's somebody with an addiction or something, and then the codependent that is always the martyr saving. And it's this vicious cycle that you can find in families of addiction. But one of the things that has to change for someone to get sober, because what often happens is if someone's using as a coping skill in a relationship and then they stop, you are basically dealing with a new person and you have to relearn your whole dance. I had a situation once where it came up. The man was using, and he would often use, because he was like, well, his partner, she doesn't listen to me anyways, I'm just going to do what I want to do. Well, he started to get sober, and she was, I want you to get sober, blah, 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 front and center. Well, he started getting sober, and then he wanted to look in the finances. He wanted to see how the household was being run. And then, oh shit, over here, partner's like, no, this isn't going to work for me. You haven't wanted to have anything to do with this in 20 some odd years. And he's like, wait a second. And so then the behavior started back up that would trigger use. Mm-hmm. So the dance needed to change. Otherwise, they were going to be stepping all over everyone's, feet. So that's important. And it's something that when this is a hard conversation to have, but when I work with people that are in recovery and I bring their partner in, I'm like, look, I don't know if you two are going to work out sober, because you guys are in such this dysfunctional pattern that you are both going to need to learn healthier ways to interact. And I don't know if you're going to like each other.
That's why we'll refer families a lot of times to support groups like Al-Anon.
Yes.
Because substance abuse and addiction really is like, if unless you're living on a mountain with your pet goat and you have no friends or family, like, okay, fine, we're not going to have that conversation. But 99.9% of the people that I've worked with do have family that love them very much and are scared shitless, and they don't want their loved one to die or continue this, and they don't know what to do. And so I'll give another example. Okay, so I would see this a lot. The addict would come into the psych hospital, and after being there for some time, we would evaluate them. We'll do our psychiatric evaluation and treatment, and we would give them a working diagnosis of usually like unspecified psychotic disorder, potentially like substance induced. And you monitor them and you evaluate them. And sometimes people would end up being is that it was substance-induced psychosis, which means they used a substance, they became acutely psychotic, it cleared.
Time out real quick.
Sure.
Give me some examples of what drugs can cause that, because I think people think they have to be using like LSD or acid.
Oh, no. Certainly don't do LSD or acid, because you can wind up in a lot of places, including the psych hospital. But marijuana, for example, you brought it up earlier, and I don't want to sound like the anti-marijuana, prude nun over here. I have my thoughts and feelings about it, but yes.
But you've seen it clinically, and I
have seen it clinically almost every single day. We would have at least one person come in who was totally psychotic, who ended up being positive for marijuana and marijuana only. And
let's let that sit there a second.
Yes.
Because I'm sure there's people like, but pot is, and we'll get on that topic later. But this is just the science. Science. Okay, so marijuana is one. Meth psychosis.
Oh, meth psychosis is awful. It's terrible. And that is just, oh my God, that's a whole episode.
There was someone who set their feet on fire.
Oh, yeah. I am not surprised. I have seen it all. Cutting off your limbs and appendages because of a meth-induced psychotic episode. It's terrible. But marijuana, okay. And I've talked to people who are like in their 40s and 50s who still dabble in marijuana, and they're like, oh my God, in my day, the marijuana was more subtle. Nowadays, like the strains are a lot. And I'm a super nerd. Like I don't smoke marijuana. Actually, you know what? This goes aligned with this episode. We talk about you don't necessarily need to be addicted to marijuana or an alcoholic for it to be a problem for you. Here is a personal example. Like I said, I've never drank a beer to myself. I've never been a big drinker. But after me and my boyfriend broke up, that 18 to 22 range or 21 range, I decided I'm 22 years old. I'm going to drink some alcohol. even though I hate the way it tastes, every single time I drank alcohol, it became a mess because I didn't know my tolerance. And every time I drank, thankfully, I never got like a DUI or anything like that. I would end up puking everywhere and making a fool out of myself. And okay, this is so embarrassing to admit, but here it goes. When I graduated with my bachelor's, my mom threw me a party at this local like bar hangout that I really, really loved in San Diego. She got it like catered. We had these like canopies and I was like living it up. And I was like drinking as though like I do this often.
Oh no.
Yes. And the next day was my graduation. Well, I woke up the next day completely hungover, throwing up constantly. I had to go to my graduation with a barf bag underneath my like graduation robe. And I ended up having to like run to the bathroom in the middle of the graduation ceremony to throw up. I am admitting this just to give you guys some insight. Like, and that was maybe like the fourth or fifth time I've ever drank in my life. And let me tell you, it was one of the last times.
Well, yeah, now we understand why Deanna doesn't like alcohol.
You know? And so that's like a pretty good like, I think that's a good example of showing you, like, I don't need to get 10 DUIs, lose my job, lose my entire family for me to be thinking I must be an alcoholic. I must have a serious problem. It was a serious problem. It was impeding my functioning. My family was looking at me like, do you have a friggin' problem? Because every time you drink, you're throwing up everywhere. You can't handle your alcohol. It was a moment of reflection for me to go, maybe this isn't for me. And I just moved forward. And since then, my husband has not even ever seen me drunk. I'm 34 years old. We've known each other for 4 years. He's never even seen me drunk because I just don't even want to get to that point.
One of my favorite metaphors is that elevator goes all the way down to the ground floor. You can get off where you want to.
Right.
Meaning when you recognize something, anything, and it could be addiction, it could be a substance, it could be a bad relationship, it could be a shitty work situation. It can go all the way to the bottom. Where do you want to get off?
Exactly. And you know what? I can give you another example of marijuana, just going back to the topic at hand. When I was like 19, 20, I tried marijuana for the first time. And good old neurotic Deanna over here had the most epic, horrible panic attack. You know that viral video that is on the internet where the guy ate the brownies and he called 911 and he was like, me and my wife ate brownies and we're dying.
Yeah.
We're dead. We're dead. That was me. Like, I'm not kidding. And so like maybe 6 months after that, I tried it again.
Just to check.
Just to do it all over again. And guess what happened? A panic attack. It was awful. So it took twice for me to go, this is not working for me. And since then, I don't drink, I don't smoke. It's been over 15 years, you know. That's what I talk to people about. It's like, listen, let's just look at how it fits into your life. Are you able to function? Are you able to still wake up the next morning and be okay? It's not all or nothing, you guys. Like, it just isn't. And so with the marijuana thing, there are people that I would see time and time again that would smoke marijuana, have like some psychotic episode where they were delusional or hallucinating, not acting right, being really scary and bizarre, and their family brings them in. They clear up, they go home, and maybe they were having a Deanna moment where they went, that really couldn't be from the marijuana, and then they smoke marijuana again, and then they're back in the hospital. I literally see them like 2 days later.
It's so sad. It's like the definition of insanity.
Right. More often than not, people are not recognizing that. It's like when things aren't working, like you should probably consider not doing it, because unfortunately, like I almost feel at times like I was the exception to the rule. People just keep forcing it. It can't possibly be the marijuana, so I'm just going to keep smoking. Meanwhile, they can't hold a job. Their families are about to kick them out. But marijuana is natural, and I have a medical marijuana card because my doctor told me that I can have it. Dude, You paid $75 to have somebody give you like, stop it.
Well, and you could even say that too. I think this goes to, again, you're talking about the pot part, but insert alcohol, insert prescription medication, anything where it's starting to really mess you up and mess up your functioning. One of the things I always like to bring up is, what are your job requirements? For instance, if you're worried that the next time somebody is going to pop a drug test on you, if you're going to pass, to me that says red flag, because there is a clear connection between what you're supposed to be doing for work and what you're doing at home. So if you've got really great ways to cleanse your system so you don't test dirty at work, that means you put a lot of thought and effort into it. Now, you can agree or disagree with your work policies, but they are what they are. And I'll take that one step further. I've worked with athletes who've been on scholarship to play sports. They can't play sports because they test dirty for pot. Now, first things first is they weren't supposed to be using unless they were 21. I think it was and none of them had a card, first of all. And now you mean to tell me it's not a problem, but you're going to school on a scholarship to play sports, and you cannot play sports because you cannot stop smoking pot. Fucking big red flag to me.
Right.
You can't argue with that. So those are the things where I'm like, let's just break this down to a very basic level, that's not okay. It's not okay because those are the parameters which you are supposed to be functioning as an adult. Now, one thing I also wanted to point out, because we've talked about, this is kind of turned to pot and alcohol, but one of my favorite things to do, and this is being a friend of mine, I can't play it with you, Deanna, but I will ask people, how many drinks do you have in a week? And not because, listen, the chart I'm about to give does not diagnose people as an alcoholic, but the same way you have to track calorie content in your food so that you don't put on a lot of weight, we also need to be aware of how much alcohol we're putting into our system, because it's a toxin, So this will blow people's minds. Do you know what constitutes heavy drinking in a week for a woman? How many drinks do you think in a week, in a 7-day period?
In a week for a woman?
This is, by the way, this is from the CDC, and it's for, quote, excessive alcohol use. So addiction aside, I want you to think about this, is because people get all bristled up when I bring this up. The same way people say you should have a certain amount of calories a day. How much do you think is considered excessive in a week?
In a week.
For a woman?
For 10.
10. Okay. And I feel like you were going to say 14, and then you went down 10 because you think it should be lower.
14 is also my favorite number.
Okay. Well, according to the CDC, heavy drinking is 8 drinks or more per week for a woman.
And that's less than 2 drinks a day.
Right. Now, a drink, this is the important thing too. A drink is 12 ounces of a 5% beer, which, by the way, the beers I like are all over 5%.
I was going to say, the most my friends usually drink are the 7% or 8.5 or whatever.
Right. It is 5 ounces of a 12% wine, which, by the way, no one pours a 5-ounce glass of wine. That's
how small? That's like a few.
Right.
It's like a few gulps.
And all right. Yeah. And that's a 12% wine. And a lot of wines are not 12%. And it is a 1.5 ounce shot of an 80 proof liquor. Now, you order a Long Island and you've got several drinks in one drink. You order a big glass of wine, you've got more than one drink. So 8 in a week now.
So basically one night of partying with your friends, you've pretty much, you're at the threshold.
Right. And that's like binge drinking. So binge drinking is 4 or more drinks consumed on one occasion within a couple of hours, 2 to 3 hours. You can do that in a party, no problem. Now for men, it's 15 drinks in a week. That's like 2 beers a night is heavy drinking. So I bring this up because then people are like, well, are you saying I'm an alcoholic? I'm not an alcoholic. I do this. No, I'm not. I'm saying the same way, because my metabolism fucking sucks. I have to watch how many carbs and how much sugar I eat because my body reacts that way. We need to be aware of the things we're putting into our bodies. Mm-hmm. Especially because, for real, I mean, there might be some research here and there on alcohol having certain protective factors depending on what it is. it's not an essential part of our life.
Right.
So anyway, I'm going to drop that. And if anybody has a problem, you can send your complaints to the CDC.
Don't email us.
Yeah, because I don't care.
I want to go back to real quick, going back to the whole cannabis, marijuana smoking and tied into mental health. One of the psychiatrists that I was working with at the hospital gave me a really cool article that of course I can't find, but I just pulled up another one. And what it says, I'm going to read like verbatim what it says. There is now sufficient evidence to show that those who use cannabis, particularly at a younger age, such as around the age of 15, have a higher than average risk of developing a psychotic illness, such as schizophrenia or bipolar disorder. These studies also show that the risk is dose related. Okay. I want to be clear. I am not trying to make the argument that if you smoke weed, you're going to get bipolar or schizophrenia. When I had this conversation with the psychiatrist, what we were talking about is, okay, everyone has like a threshold for stress, for being able to manage like our homeostasis.
Mm-hmm.
And if you think about it, like I wish people could like see the video of us talking right now, because I'm like holding up my hands doing like, figures. But think of it this way, like you have your homeostasis, which is a line, across the screen.
Where things are balanced.
Balanced. As we get stressed, as we use substances, so we become altered, that balance, that baseline drops in terms of our threshold to manage stress, to manage things that can cause havoc, right?
Mm-hmm.
And if we have a predisposition to a psychiatric disorder that you haven't been diagnosed with, let's say, but you have a pretty strong family history, think of it as the thing that's like behind the gate, that the gate is still closed and it is below the baseline. As you, this is just general, like I'm not saying that every person this is going to happen, but what we have seen is people that have a strong family history, if they're smoking constantly, or they're really, really stressed, like we talk about how like young adults, like ages 18 to in their early 20s are at a particularly high risk of developing like having your first schizophrenic break. That's because of like all the stress, like the transitional stuff that happens. You move out of your house, you're on your own for the first time, college, all this stuff is stress. So that can continue to lower the bar in terms of the threshold that we can manage, right? And if it gets too far down, that floodgate opens and things can pop up, such as a psychiatric disorder, like your first manic episode, your first bipolar episode. So we're not saying if you smoke weed, you're going to get bipolar. That's not what we're saying. But you have to look at this as like the big picture of like, what are we putting into our bodies? What are we doing to ourselves every day? How are we managing our stress? How are we managing everything in our life to be able to maintain our homeostasis and our baseline? If we're not getting enough sleep and we're partying all the time and we're super stressed out and we're not taking care of ourselves and we're eating like shit and we're using drugs, then it would make sense that our homeostasis is getting compromised here. And we're opening ourselves up to certain vulnerabilities of perhaps either an acute psychotic episode or perhaps something that turns more permanent or chronic.
You could even think of it as, how when you're really stressed out and that's when you get sick. Like you're like, oh, why am I getting sick right now? Because your immune system's down and that's when it can attack. So I think that's like a pretty good kind of analogy.
That's a great analogy.
So before we get into our good news feed, because we want to turn this around and leave you on a positive note, we do want to say there's lots of resources out there. If you are dealing with what you think might be a substance use disorder, or, you want some more information on it, all you need to do is a quick Google search. A lot of insurance companies now, fortunately, at least last time I checked, still cover, sometimes to varying degrees, but addiction treatment. There's also lots and lots of support groups and information online and in your community for people dealing with addiction and the families. One of the great things that I love about the recovery community, and that man, it's like it's like a perk of a shitty situation in some cases is when I try and talk people into going to recovery groups, whatever those look like, AA, NA, Smart Recovery, Life Rank, Celebrate Recovery, any of those things, I tell them, how amazing is it that you can walk into a place where you're accepted? The general sense is you're accepted. No matter what shit you've done, no matter how bad your day is, you can walk in and people just generally accept you. And then also recognize the importance of something like getting through a breakup without a relapse, or just getting through 24 hours without using. And like, I think about it, like, how awesome would it be if just everybody in society had a group they can walk into where they could remain anonymous and people are just cheerleading for you? Like, God, we would all be so awesome in such a better place if we had that. And as part of, I guess, the positive that comes from having to struggle with addiction is that those recovery groups exist, and they are a place of growth and connection that I think can be really positive. So,
and also establish a sponsor, that's a wonderful avenue to take, in addition to the support groups. Also, don't get discouraged if you go to one of these support groups and it didn't feel right. There are like thousands and thousands thousands of support groups. Like I live in a small community compared to everything around us, like Los Angeles, and there are like 30 different groups. So I tell people all the time, if you go to one AA group or one other support group and it's like, I didn't like the leader or the facilitator, or I didn't like this, okay, well, not every single support group is going to feel that way.
Right. So you definitely want to try it out.
Also, check out SAMHSA. It's SAMHSA.gov, stands for Substance Abuse and Mental Health Services Administration. I have found like really, really good resources for patients and clients in the past. It's a wealth of knowledge, information, statistics, helplines, support groups. So check that out.
Absolutely.
I also want to end on this note because I feel like I've already had people write to me on Instagram and email me and ask this question. I want to end saying this. That client that I had, or the patient that I had that kept coming in and smoking a lot of weed and living with her parents reached out to me and were like, well, what do we do? And I said, first, you need to go to Al-Anon yourself. Second, you need to decide whether or not she is allowed to come home. And these decisions are not easy. I'm not trying to say that they are. But if she comes home, it's a whole new world. And I always encourage people to make a contract with that person and set out the rules, write it down so that there is no negotiation in the future. Like, you didn't tell me I wasn't allowed to do this, or you didn't tell me that was that rule, because then you just get into a power struggle. Write out what the rules are. Absolutely no use. You're going to have to go to an outpatient treatment. You're going to have to need to do a support group. And if those rules are broken, then this is the consequence that you need to face.
And that's why things like Al-Anon are helpful, or your own therapy, because sticking by those standards is going to be so very hard. And you need your support too.
Right. 100%. So write it out. It's not supposed to feel punitive. Your loved one that's struggling with addiction may feel like it's punitive, but these are the things that you need to do to protect your family, to protect your loved one, and to make sure that you're setting up a safe, healthy environment for healing. It may feel punitive for the person, but everybody just needs to be on the same page, and all the expectations need to be very, very clear that this is the new normal. These are the new expectations. These are the rules to foster healing and recovery instead of continuing the cycle of enabling and use.
The whole family has to get healthy. And really quick on that, for some people to get sober, they may have to disconnect from their family. There are those people out there where it's a toxic situation. And that's why we say find support groups, find your own therapist, find what's available in the community. The one thing I love about people in recovery who have really worked a program is, man, they have done so much self-worth or self-work to figure out their self-worth that it is just a whole dynamic of emotional evolution. Since we wanted to start this out, so Deanna, is it going to be you or I that shares our first good news feed story?
Go for it, Frances.
Okay. Chris Pratt, move over. You have been replaced by a slightly older, slightly more dad bod type man. Have you watched Stranger Things?
Yes and no. Yes.
Okay.
Are you talking about the police officer?
Yes,
Wait.
Hopper, the sheriff.
Yeah.
He's also playing Hellboy and got ripped for that, but I prefer him as dad bod. David Harbour is doing exactly what he should do with Twitter, and that is bringing amazing things. He recently lost a bet to a fan, and she's like, at David Harbour, what would I have to do to have you take your senior photos with me? And he said, so many thousand retweets, and I get to wear a school sweatshirt and hold a trombone. And he did. She got him. He did. The photos are floating around out there. Yes. So then someone upped the ante, and this chick sent out, what would it take to get at David K. Harbour to be the officiant at my wedding in September? To which he responded, 125,000 retweets, provided dates work with season 3 shooting schedule of Stranger Things. I will get ordained and perform the ceremony. I will get to read an esteemed love letter of my choosing. And after the cake is officially cut, I get the very first piece. Guess what?
What? It worked.
It worked.
Wait, okay. So this is also an example of the power of asking. So now as a follow-up, Frances, you and I need to ask how we can be a guest to the wedding.
I know. So, here's what I would do. I don't care. I would change the dates to coordinate so that he could be there, because that is amazing. So, you know what? We should tweet at Erica Elizabeth and be like, so what do we got to do to be invited?
Okay, I think we should. Let's do it. Because you know what? I don't know if I brought this up, but after we did that episode of The Art of Asking, I asked my followers if somebody could tell me how to get Ellen tickets after like years and years and years of trying. And like 12 hours later, I scored Ellen tickets. Did we talk about this on air?
No, but it was on your Instagram. So yeah, the power of asking. Yep.
Yeah. So like, look at all these people are asking. They asked the question. And look, they received.
And it happened. So there's just so many awesome things on here.
That is so awesome.
By the way, do you have a Twitter?
I do. I don't really use it. I should be better about it. Hold on. I actually even forgot what my Instagram or my Twitter handle is because I've changed it. If somebody can like help me with a better handle, it's humor and healing, which is one of the hashtags that I use. Because Twitter's annoying. I can't do hilarious humanitarian because there's too many characters.
Yeah.
So if somebody can like DM me and come up with a good Twitter handle for me, I'll like send you a prize. Because I need to like, Twitter is like the place to ask questions and receive awesome things.
So by the way, as I'm doing this, I'm messaging her at Erica Elizabeth. What would it take for my co-host Humor and I to be at your wedding?
I will totally go.
We bring awesome presents and we are so fun.
And Deanna is a cheap date because she doesn't drink. So if you have an open bar, you don't even have to count her in.
She doesn't drink either.
Oh my God. Okay. So while you tweet that,
go ahead and share the story.
I'll share mine. I just wanted to share the good news about the second annual Women's March that's been taking place all across our wonderful country. Mainly, I wanted to share my favorite signs people have made so far.
Okay.
And if you were born yesterday, for all the people that I'm kidding, live under a rock or born yesterday, we know that the Women's March this year was focusing a lot on voter registration for women and showing peaceful opposition to Trump's and the administration's views on issues, you know, including immigration, abortion, LGBTQ rights, women's rights, equality. So I just love it. My daughter, we talk about my daughter sometimes. She was born 15 months ago. So like the first Women's March happened like when she was a few months old. And I actually went on Instagram and I screenshot my favorite pictures of last year's Women's March. And I made her a photo album that I'm going to give to her when she's older. Just showing her like, this is what the world was like when you were born. And look at all these women standing up for you, you know, because they're standing up for a better future. And so I'm really looking, I started doing the same thing this year. I'm screenshotting some of my favorite signs, and I'm going to print them out and add them to the photo album for Micah, my daughter.
I love it.
Yeah. So here is some of my favorites. Love trumps hate. I like it. Play on words.
I like it too.
There's one that said, proud daughter of Muslim immigrants who taught me to love my fellow human being. I'd rather be a bitch than a mouse. I love this one. I know. I'm standing up for myself. I'm such a bitch. That's my favorite. I think that one's my favorite one. I liked, we need a leader, not a tweeter. And then there was this man who has a shirt that says, I love my awesome wife. And he's holding a sign that says, love, not hate makes America great. And I just loved that so much. Oh, sorry. I lied. Got one more. There's a picture of a cartoon like Trump, and he's pointing to his butt. And it says, home is where the shithole is. I'm sorry. I know we're not a political podcast, but they're using his word. And someone drew a butthole on the sign. Another sign. Can we just admit that we may have taken this anyone can grow up to be president thing just a bit too far?
No, I'm not. I want to throw this one in there because my kid's a Harry Potter fan, and it's a little girl, and she's holding one. It says, without Hermione, Harry would have died in the first book.
Yes, I saw that one this morning, and I almost screenshotted it, but I've never actually seen Harry Potter movies, so I didn't really.
Me neither, but I did.
Oh, okay. Well,
but my kid did. So yeah.
Perfect. I just love it. The silver lining is that, the people that are feeling all sorts of things about Trump being our president, they're taking this as an opportunity to get together and stand up for each other and support each other. So I just feel like that's my good news feed for this week, is just looking at the power of the people coming together.
All right. We want to say thank you to one special listener who reached out.
Yes. We end all of our episodes with reading out one of our pieces of fan mail, the postcard that we got. This is from Chris. And the postcard says, all good things are wild and free. I agree. The part I agree was me.
Okay. Hey, we're free too. This podcast is free, and it happens every single week. We hope that you've enjoyed it. I kind of like the vibe of how this one went. I feel like it was helpful. People have been asking for a longer one, and so there you go. You can rate us, subscribe, follow us. We're on YouTube. We're on iTunes, Google Play. Where else?
Stitcher, TuneIn, but really just find us on iTunes or YouTube.
Yeah. But we're like trying to get everywhere.
Prepared. Yeah, we really are trying to, just Google. If you Google us, Hilarious Humanitarians Podcast, it'll actually just pop up.
All right. And so we'd like to thank you for joining us this week. Hilarious Humanitarian. Deanna, you can find on social media. You can find me, Shut Up Skippy.
We'll see you next week, guys. Love ya.